All right, to start out, I would perform hand hygiene. I would put on PPE gear as indicated. Once I go into the room, I will ID the patient with 2 identifiers, and I will explain the procedure to the patient. With getting sterile gloves, I'm going to make sure the glove package is dry, and I am simulating that this package is unopened. The table should be at least waist lengths or waist height up here. So I'm going to be simulating that throughout this procedure. So I'm going to, with this simulation, there would be an outside package. I would open that and I'd peel the top layer back and I'd remove this inner package and I would touch the outside of it only. Now, right here it says cuff end. That would be facing towards me, closest to the body. And then I would open the package, only touching the outside, not the inner surface. So I will do that right now. So this 1-inch border I am allowed to touch. So I am going to open this. Again, throughout this, making sure there's no abnormalities and it's looking good. So I'm going to use my non-dominant hand first, and I'm going to grab the folded part of the cuff, the part of the glove that is exposed. Okay. I'm going to lift it up off the sheet, and I'm going to put my hand in with my thumb facing out. Again, above waist length. And my contaminated hand is only touching the outside of the cuff. Again, keeping my hands above my waist and keeping my fingers down. Again, sterile touching sterile. That's it. So now I'm going to take my dominant hand and I'm going to put it underneath this cuff, touching only the sterile part of the glove. And I'm going to keep my thumb outside. Again, I'm lifting this up off of the paper, and I am going to put my hand in just like this. Good. And now that my gloves, both of my sterile gloves are on, I am able to adjust the ends of my gloves. Again, only touching the outside and not the folded part. Okay. So now I am going to do whatever procedure I would normally do and let the patient know what I'm doing. Once I'm done with that, I would take my gloves off. So with my dominant hand, I am going to pinch the outside cuff here and roll it off and put it in this hand. With my dominant hand, I'm going to place my finger underneath, making sure I'm not touching the outside, and rolling the gloves in on itself. I would throw this away in the appropriate trash bag, as well as if I was wearing PPE, I'd take that off too, and then I'd wash my hands. And that's how you put on sterile gloves.